Welcome to the deep dive. Today, we're tackling a topic that I know probably resonates with quite a few of you who share your lives with dogs.
Mhm.
We got a really great question from a listener about their dog's, ongoing tummy troubles.
Right.
And we're going to dive deep into canine irritable bowel syndrome or, IBS.
Exactly. Yeah, we've got a really detailed veterinary resource here. It breaks down what canine IBS actually is, looks into the possible reasons behind it, how vets go about diagnosing it, and then, of course, the different ways it can be managed.
Okay.
So our goal really is to take all this info and sort of boil it down into clear, understandable insights, especially for a listener who asked.
Okay, great. So let's jump right in. What exactly is canine IBS? I mean, it's got to be more than just a random upset stomach, right? What's the key difference?
Yeah, you're absolutely right. At
Yeah.
its core, canine IBS is it's a chronic thing. Dogs experience these intermittent problems with their GI system,
Oh.
often involving the large intestine specifically.
Mhm.
And there are also issues with how their gut muscles move. That's called dysmotility. Basically, the normal rhythm of digestion gets disrupted.
Ah.
But the really crucial part, these issues happen without any identifiable structural problems or other diseases causing the signs. So, like, the actual plumbing looks fine on examination.
Interesting. So it's more about how the system is like working rather than a physical blockage or actual damage.
Precisely. And, the source material brings up something pretty fascinating. This idea of a psychosomatic connection.
Oh.
Yeah, it suggests there might be a link between a dog's behavior and how their autonomic and enteric nervous systems respond. That's basically the communication network between the brain and the gut.
Wow. So you're saying a dog's emotional state could actually like physically affect their gut health? That
Yeah.
feels like a really key point.
It's definitely hypothesized, yeah.
Mm.
The resource points to maybe a few interacting causes, things like abnormal movement in the colon,
Mm.
maybe not enough of the right kind of fiber in the diet,
Right.
sensitivities to certain foods, and yes, stress and anxiety are definitely mentioned as potential contributors.
Okay.
What's kind of surprising, though, is that while it might feel common if your dog has digestive issues, IBS itself is the primary problem.
Yeah.
The resource estimates it affects less than 5% of dogs.
Less than 5%. Really? That is surprising. Are there certain types of dogs that might be more prone to it?
Well, the source notes that really any breed can be affected, but there is a suspicion, an idea that it might pop up more often in really active working dogs or maybe dogs with naturally anxious temperaments.
Huh.
So that might ring a bell for listeners who have those kinds of high energy or perhaps more sensitive dogs.
Absolutely. Yeah. Now, okay, what are the signs, the telltale signs that a dog might be dealing with IBS? What should you, as a pet owner, be looking out for?
Right. The history is super important here. Typically, what vets see are ongoing intermittent signs, and they're usually related to the large bowel.
Okay.
This often looks like a dog needing to go out frequently, but they only pass small amounts of stool each time.
Mm-hmm.
You might also notice more mucus in the feces, maybe even some blood. The technical term is hematochezia. That just means bleeding in the lower part of the digestive tract.
Right, blood in the stool.
Exactly. And straining to defecate. That's called dyschezia. That's another common sign.
Oh, that sounds really uncomfortable for the poor dog.
It certainly can be.
Yeah.
And the source also mentions that some dogs might actually have alternating symptoms, so like periods of diarrhea followed by constipation, or they might even switch back and forth.
Wow. Okay.
Less commonly, you might see other things like abdominal pain, maybe some bloating, sometimes called segmental ileus, and even vomiting and nausea occasionally.
So it's a bit of a mixed bag, but the recurring theme seems to be these chronic, kind of large bowel issues.
That's right.
What about triggers? You mentioned stress earlier. Is that a big factor?
Yeah, and the resource does specifically call out stress as a potential risk factor. Things like, big changes in the household, sudden diet switches, maybe separation anxiety.
Mm-hmm.
These may be linked to flare-ups in some dogs. But, and this is important, the resource says may or may not,
Ah, right.
which really just highlights how complex IBS can be. It
Mhm.
really varies from one dog to the next. It's not always a clear cause and effect.
Gotcha. So, okay, if you suspect your dog might have IBS based on these signs, what's the diagnostic process like? What should you expect from the vet?
This is such a critical point. The source really emphasizes that IBS is what we call a diagnosis of exclusion,
Exclusion, meaning,
meaning you have to rule everything else out first. Think of it like detective work, a process of elimination. We have to systematically check for and rule out all the other conditions we can test for, the ones that cause similar signs.
okay.
Before we land on IBS, IBS is more of a descriptive diagnosis based on not finding anything else specific.
So it's not something a vet can just spot in a quick exam. Sounds like it could be quite an investigation.
Exactly right. It often is. The resource outlines a pretty comprehensive workup that should happen first. Well, things like gastrointestinal biopsies, taking tiny samples to look for structural changes or other diseases like IBD. Also, therapeutic deworming.
Therapeutic deworming, different from regular deworming.
Yeah, it's often a more intensive or broader spectrum approach to really make sure specific parasites, like whipworms, which can totally mimic IBS signs, aren't the culprit.
Okay.
Then trying diets with maybe increased fiber or even doing strict elimination diets to check for food sensitivities or allergies.
Right.
And only if none of those steps resolve the problem, then IBS might be considered more strongly.
Wow, that sounds incredibly thorough.
Yeah.
What are some of those other conditions vets need to rule out first?
Oh, the list is pretty long, which just shows how many things can cause similar signs. Our source kind of groups them.
Okay.
First, causes of large bowel disease itself. Things like whipworms again, inflammatory bowel disease, IBD, certain bacterial infections, Clostridium, E. coli colitis, fiber-responsive diarrhea, dietary indiscretion, eating garbage or something they should, pancreatitis, even some fungal infections like histo or apotheosis.
Wow.
Also, colorectal cancer, weird thing called cecal inversion, gluten issues in some breeds. Even anal sac problems can sometimes present similarly.
That's a huge list just for the bowel itself.
It is. And then there are diseases that might have similar signs but aren't directly large bowel problems.
Like what?
Things that cause straining or changes in urination or defecation. Source mentions dysuria and stranguria, that's painful or difficult urination, maybe from bladder issues.
Okay.
Prostatic disease in male dogs, sometimes internal scarring or adhesions, and even disorders affecting the nerves that control the whole GI tract.
So it's not just about the gut. Okay, so when they do the standard tests, like blood work, what do those usually show in a dog that does have IBS?
Interestingly, the source says that the routine stuff, CBC, biochemistry profiles, urinalysis, they're usually pretty unremarkable in dogs with actual IBS, which kind of supports the idea that there isn't some big underlying systemic disease causing the symptoms,
Right. Right. And what about more specific tests like stool samples or imaging, like X-rays or ultrasound?
Yeah, things like fecal flotations to look for parasite eggs or rectal scraping cytology to check cells. Those are also usually normal.
Okay.
And imaging, standard X-rays, contrast studies, even abdominal ultrasound, they typically don't show anything significant either. Sometimes, maybe, the X-rays might show a bit of gas buildup in the colon, but often nothing obvious.
So basically all these tests are mostly about confirming what it isn't.
You got it. That's exactly the idea behind diagnosis of exclusion. Even endoscopy. Putting a small camera into the GI tract and the biopsies they take during that, usually unremarkable in dogs with true IBS. Although the source does make a point that sometimes a dog with IBS might also have another chronic gut issue going on, like maybe mild IBD, and that would need its own separate management plan.
Okay, right. So after potentially all that investigation, if IBS seems like the most probable explanation, what happens next? What are the treatment options? What can actually be done to help these dogs feel better?
Yeah, so treatment for canine IBS really comes down to managing the symptoms. And diet is often like the cornerstone.
Yeah, makes sense.
The source recommends a highly digestible diet, but importantly, with added fiber, often a mix of both soluble and insoluble fiber.
What kind of fiber?
Well, examples given are things like psyllium or wheat dextrin for soluble fiber, and maybe methylcellulose as an insoluble type. But it also notes that how a dog responds, whether they do better with more soluble versus insoluble, that can really vary.
So finding that right dietary balance might take some trial and error with the vet.
Exactly. It's often a bit of a process. And then alongside diet, medications are frequently part of the plan.
Okay.
The source mentions that meds can range from just short-term use during flare-ups to potentially lifelong management, depending on the dog's situation. It points out that a lot of dogs with IBS seem to deal with both the gut moving too much or erratically, that hypermotility we talked about, and potentially some changes in sensation, like maybe increased sensitivity or nerve-related issues contributing to it.
Okay, so what kinds of medications are typically used to tackle those issues?
Well, for the hypermotility and maybe that nerve-related pain component, the source mentions a drug called Librax. It's actually a combination of an antispasmodic and a mild sedative or anxiolytic.
Interesting.
Or sometimes gabapentin is used, often for potential neuropathic pain. The advice is usually to start gabapentin at a lower dose and kind of adjust it as needed.
Okay.
Then you have medications that more directly affect the gut movement itself, motility modifiers.
Like what?
Opiate-based antidiarrheals like loperamide, that's a Imodium or diphenoxylate, they work by slowing things down and increasing the normal sort of squeezing contractions in the intestines. Gabapentin is mentioned again here, potentially for that nerve pain aspect. And then for dogs where constipation is the bigger issue, a prokinetic drug called cisapride, which helps get the gut moving forward, might be used.
That's quite a range, targeting different angles. What about those antispasmodic tranquilizer combos you mentioned, like Librax? When are those generally brought in?
Yeah, those combinations. Librax is one example. Others mentioned are darbazine and aminopendamide. They're often used to help specifically with anxiety, abdominal cramping or spasming, bloating, and just the general distress that can come along with an IBS flare-up. Sort of targets the gut and the potential stress component.
Okay, that makes sense. And what if a dog is feeling so rough, maybe nauseous or vomiting, that they can't actually keep oral meds down?
Good question. In those situations, the source suggests using injectable anti-nausea medications. So given parenterally, not by mouth,
Right.
just for maybe a day or two to get things settled.
Yeah.
Meropitant, Serenia, and prochlorperazine are the examples given.
Got it. The source also briefly mentions something about serotonin-like antagonists. Is that a common treatment here?
Yeah, it mentions rambocitron. Apparently it's used in people with IBS, especially the diarrhea-predominant type.
Okay.
But the resource specifically states that its use in dogs really hasn't been widely reported outside of some experimental studies in healthy dogs. So no, not currently a standard treatment for canine IBS.
Good to know. Are there any medications that should generally be, avoided or used very carefully in dogs with IBS?
Yes, definitely. The source lists some important contraindications or precautions. For instance, opiate antidiarrheals should be used carefully in dogs with breathing issues, liver problems like hepatic encephalopathy, existing constipation, or if they're very weak or debilitated.
Right.
And another class, anticholinergics, which can sometimes be used for cramping, are generally not recommended for dogs with certain heart conditions, kidney disease, high blood pressure, constipation already, or hyperthyroidism. So it's really vital, for you as the owner to know your dog's overall health picture and discuss any potential medications really thoroughly with your vet.
Absolutely. Crucial point. So, after starting treatment, what can someone realistically expect? When might they actually see their dog starting to feel better?
The source actually offers some pretty encouraging news there.
Mm-hmm.
It suggests that you should typically see improvements pretty quickly. Things like better stool consistency, less mucus, and relief from the straining and abdominal discomfort, often within about 1 to 2 days of starting the right medication.
Oh, wow. 1 to 2 days. That's relatively fast. That's good news.
Yeah, it can be quite responsive when the right approach is found.
What about the long haul, though? What's the long-term outlook for dogs diagnosed with IBS?
Well, the long-term prognosis, it can vary quite a bit. For some dogs, the symptoms might actually completely resolve with consistent management, which is fantastic. But for others, they might continue to experience ongoing intermittent flare-ups throughout their lives. It really depends on the individual dog.
Yeah.
So it's important to be prepared for the possibility of needing long-term management and to keep working closely with your vet to tweak the strategy as needed for your specific dog.
Okay, that makes sense. So just to kind of wrap up the key points, canine IBS is this complex gut disorder. It's diagnosed mainly by ruling out everything else.
Exactly.
And managing it often involves a careful combination of dietary tweaks, usually adding fiber, and then various medications chosen to target the specific symptoms that dog is showing, whether it's motility issues, pain, maybe anxiety.
That's a perfect summary. And I think the big takeaway really is just how individual IDS in dogs is. What works wonders for one dog might not be nearly as effective for another.
Right.
It often takes real patience, careful observation from you, the owner, and a strong partnership with your veterinarian to find the approach that works best for your particular furry friend.
Absolutely. Yeah, it really sounds like that open communication and teamwork with your vet is absolutely key. Thinking about this, especially that potential link between a dog's stress or emotional state and their actual gut health, it really makes you wonder, doesn't it? What other connections between our pets' minds and bodies, their emotional well-being and their physical health, are we maybe only just starting to scratch the surface of understanding? It's definitely some food for thought. Thanks so much for walking us through all this.
My pleasure. It's a really important topic.